Good afternoon, ladies and gentlemen. My name is Mickey. I am your host of the Beyond Page One podcast. Today's guest is a true pioneer in the field of medical aesthetics space in Canada. Tracy Hotta is here, and she is the president of THMA Consulting. Has nearly 3 decades of experience in shaping the landscape of the aesthetics nursing world in Canada, from being one of the first RN injectors in the country to leading national training programs and mentoring new practitioners. She brings a wealth of insights and experience into the entrepreneurship, the patient safety, and the art and science of the aesthetics space. She's a leader, an educator, an advocate, and we are thrilled to have her today. Tracy, welcome to the show.
Great. Thank you very much for this opportunity, Mikey. This is awesome.
Yeah, of course. We're happy to have you here. Such a dynamic and inspiring journey that you've had, looking through kind of, obviously I've done my research. Can you take us back a little bit to what first drew you into nursing and eventually into the world of the medical aesthetic space?
Sure. I mean, it's been quite a journey. I graduated back and I just had my 40th nursing anniversary. So I go back to graduated in 1984 from nursing, but my first desire to become a nurse was when I was 9 years old. And I would go to my dad's office. He was a GP in Moncton, New Brunswick. And I would go there on the weekends just to help out. And that's where I met his nurse, Alice. And I was intrigued by her confidence, organizational skills. She was so respected from the patients and my father and had a true passion for nursing. That's when I first decided that I wanted to be a nurse. And caring for others has always been in my nature. So if somebody asked me 30 years ago what I would be doing at this point of my nursing career, it would not be in aesthetics. That is not the path that I had intended on taking. I moved to Ontario 3 years after graduating from nursing and was working in the operating room with a plastic surgeon who decided he wanted to open up one of the first out of hospital premises cosmetic surgery facilities in Toronto area. So I was 28 years old and he was like, "Yeah, you want to come and manage it?" And I had no idea. I had operating room skills, but no management skills. And he certainly saw something in me that I did not see. So I
Amazing.
thought, yeah, it's a full time, it'll be a great job. So I managed the clinic for 5 years, but also still worked in the hospital because I thought definitely this little bubble was gonna burst.
Hmm.
But it was amazing. So that was back in 1990 that I started working in his office. And being aligned with a plastic surgeon at that time, where there was no other nurse injectors, really opened some career paths for me because we worked really well together and we were entering this whole new space together. In 2005, I became the first Canadian president of the American Society of Plastic Surgical Nurses. So that was a really high point in my career. And having to be in that position, and there's been no Canadians since. I'm hoping that there will be, but I'm still holding that title.
Yeah.
Had to learn leadership skills and organizational skills, which I really didn't have. Policy development, strategic planning. I even had to testify at the FDA hearing for the silicone breast implants. So that was
Oh,
amazing. Yeah.
wow.
So, yeah, that was terrifying.
Yeah, no kidding.
um, because since I was president of the association and I did work with plastic surgeons that use silicone breast implants. So this kind of reinforced my need to be an advocate for the nurses and for patients. And moving forward from 2005 of working under the American Society, we started a Canadian society. And CSASN is still established today. It's the leading voice for nurses in aesthetics. And my biggest accomplishment with starting CSASN is that we had a task force of 10 nurses and we developed the practice standards and guidelines for across Canada, which the provincial nursing colleges still use to this day. And we've had 3 revisions since. So every 5 years, we'll revise the practice standards. So 2016, sort of launched THMA Consulting, went into my own practice. And that's where I really decided that I really loved the educational piece. And with this, in order to develop this program. Sort of did a gap analysis to see what was missing with training. And we were the first ones to start a business ethics and professional standards and had that as part of our training program. So, learning, how to inject, but also the why to inject and
Yeah.
following your standards. So I just became very passionate about the education and, being an advocate for nurses and for patient safety. So
That's
that's kind
awesome.
of how I got into it.
That's awesome. I mean, obviously, you were one of the first to be a part of it, right? So you've seen the aesthetics, medical aesthetics community evolve tremendously over the past few decades, I'm sure. What were some of the biggest challenges that you faced as a practitioner and on the business owner side navigating that evolution?
Yeah, it's a couple of the biggest challenges. Um, they would be one was how to run an independent practice. So nurses don't do business. We take care of patients, we don't do
Yeah.
business. And then having to sort of navigate into this space, it was totally out of my realm. And how do you ask patients for money? When we're not used to doing that in the hospital. So that was a huge challenge. We don't sell. It's difficult to determine the cost of your services because, typically we would say, okay, well, a syringe of filler is $250, and that's what you just double it and charge that. But knowing when you're looking at the business, there's a lot of other things that come into play. So you've got all your material costs. We're looking at our annual dues, our insurance, liability, business insurance to have your own practice. If you needed an authorized prescriber, you had to pay for that authorized prescriber. You had to take that into account. And the continuing education. I would say probably most nurses spend at least $10,000 to $15,000 a year for continuing education because it is such a growing, it's a ever changing field. It
Hmm.
always has been right from the very start. And nurses don't have the hospital, and when they're independent, they don't have the hospitals to do lunch and learns and things like that. We have to take it upon ourselves to do it. So we have to take that into account of how much that we charge for a procedure. And I always tell nurses that they should not undervalue their clinical knowledge and their skill set to be successful. So, all these things have to be taken into account. So that was a big challenge. The second biggest challenge was social media. Because when I started, there was no social media. This was back in 1990. To try to get patients, we had newspaper ads, and everything was. We got our patient list according to patient referral, not from advertising. And we would go to hotel rooms and we would have little seminars and bring our patients in there and teach them and educate them that way.
Yeah.
So when social media came in, that was huge. Just even having a website.
Yeah.
Um, it was, yeah, I found that probably was the hardest and going, I'm not going to do that. I don't need to be. And then you have to have social media. Like it is definitely have to have a marketing tool to market your business. When it first came out, it was very disturbing of what people were putting on social media as nurses because it was very degrading to the profession itself because people just wanted to get followers.
Yeah.
And we have our professional standards that we have to follow. And when we give the title nurse, we have our code of ethics. So that was a challenge of trying to um, not teach nurses, but educate them on proper social media etiquette
Yeah.
when you're putting your name on it, saying that you're a professional nurse. So that was tough, and it's still tough to this day.
Yeah.
It's still something that everybody's trying to deal with, and the college is trying to deal with it as well. So those would be my two: business, setting up your own business, and social media.
So, yeah. And it's still a challenge, I'm sure, because it's changing ever so quickly, the social media space and the digital marketing landscape. It's crazy how quickly it changes.
And there's a benefit to it. There's a lot of benefits to social media, but there's a lot of risks for nurses in the profession.
Yeah, of course. You've worked with, top surgeons and clinics across Canada. Was there a particular like pivotal collaboration or like a mentor relationship that really influenced, your approach?
Yeah, I mean, Definitely the opportunity to manage an operating room. That was one of the first ones that were in the Toronto area.
Hmm.
That was definitely a turning career, for my career path. And the plastic surgeon that I worked with saw the potential in me, when I was 28 years old, that I had the ability to manage an operating room. So this really allowed me to look outside the box of the traditional institution nursing and really, hone in on some entrepreneurial skills because I had my own business within his business once I started injecting.
Hmm.
Um, I think that I don't think that I realized the impact that stepping into this uncharted territory had. I just kept sort of moving ahead with what needed to be done. And my plastic surgeon was there with me the whole way because we were working on this journey together because it was new to him as well. He was
Hmm.
already injecting, but a nurse injecting. And his whole thing was, what if you stick the needle in their eye? I said, well, why would I do that? It was a learning curve for both of us and a learning curve for the nursing college as well.
Hmm.
But working with him, I could attend physician colleges or physician meetings because he was a plastic surgeon. So I had that ability where other nurses weren't allowed to attend any of these. So we really had to educate ourselves. And I just learned that he is retiring after 35 years. So he's retiring. He just
Wow,
sold his cosmetic practice in Toronto, and I'm forever grateful because without him, I wouldn't be where I am today. So I
that's
wish him
awesome.
a happy retirement.
That's awesome. Um, for somebody that's new to the aesthetics world and they're just coming into it, whether they're a nurse graduating or wanting to a career path or shifting career path, what's one common misconception they often have that you'd like to clear up early when training with them?
Yeah. I think the first one, when we start our virtual courses, I always ask them, why they want to get into aesthetics.
Hmm.
And a lot of them will say, it looks like it's a great side gig and it's a great way to make money and things like that. And I say, then this course is not for you. Because I think it's a lot of times they see what's on social media and it makes it look very glamorous on social media, but there is a lot of extra work that needs to go into being in aesthetics. So that's what I kind of like to press on them, that you're not just going to take the course and then hang up your shingle and everybody's going to come to your clinic to have
Yeah.
procedures done. That it does take a lot of work and you have to be accountable for what you're doing. It can be financially lucrative, absolutely. But I wouldn't say that it's easy. So it's a lot of education, work, finances. It's not just the cost of the course, it's everything else that comes after it in order to maintain your skills, and the commitment. So they have to devote their time, commitment, ongoing education to be successful.
Yeah, of course. And how long is a course with you or a training session? How does that work?
Yeah, with our course, we do a 5 virtual courses first. And they are taught through Zoom, but it is in person so that they can ask questions, which is good. So those are 3 hours a day, typically on a Friday, Saturday, Sunday, Monday. And one of the assessment course is a pre-recorded, and then they can ask questions about that during that weekend. They have access to these courses as long as they want to, for so that they can review them. So they take them once, and then 3 years later they can take them again.
Hmm.
Once they finish that, and they have to pass a test to make sure that they have the proper knowledge to go into the in-person training. And the in-person training is typically 1 or 2 days, depending on how many people are in that course. But we do one-on-one training. There's no group training. So
That's
we have
awesome.
an instructor with one provider and one
Yeah.
patient.
Wow. Very
Yeah,
cool.
yeah,
So I want to talk a little bit about THMA. Starting and scaling a national training organization is can't be easy. What were some of the early strategic decisions that grow helped you grow across so many regions?
yeah. I mean, this was my second training company. My first
Okay.
training company that I had developed was when we first started being nurse injectors in Canada. So it would have been back in 1998, probably, is when I started that because there was nowhere for nurses to be trained. So I developed that along with the industry person that came over from industry. We developed a training company. A company in the US bought all my training material to submit to the FDA for an HA filler that was being approved. So I was like, that was early 2000. I was like, been there, done that, don't have to train again. Then a number of colleagues had asked me to, because I had, you've got so much knowledge in your head, why don't you need to, disseminate that knowledge? So 2014, I started to really think about it. And that's where I did put a survey out just to get the sort of get to the gaps in training to see what we should focus on, to be a little bit different and making sure that people get sort of that global amount. The main gap was anatomy. So we do a 3-hour course on anatomy. And it's not textbook anatomy, it is related to aesthetic injections. So it took about 2 years to develop that whole course because there were study guides and presentations that go with it, that have to go, side by side, and then getting all the resource articles to support it. Before COVID, it was always in person. We taught these courses in person, and then when COVID hit, we could do all this virtually.
Yeah.
So that's where I would teach the Friday, Saturday, Sunday. I had somebody else teach the Monday course, and we could do that across Canada. And then I have 13 training sites across Canada that then I would push out the people that took the training, the virtual courses, push them out to the training centers. All the training centers are within clinics so that they follow the public health guidelines. We don't inject out of hotels or anything like that, because we want to keep our standards as high as they should be.
Yeah, makes sense.
And I still continue to, I just changed the course up. I went to a meeting last week and just changed some more information in our course because things are constantly changing. It's
Yeah,
crazy. And a training program should not remain static. It needs to change with,
with everything else. Yeah,
yeah, yeah.
100%. Um, the industry is driven a lot by, visibility, right? Being found online, especially, everyone has a cell phone nowadays and we're glued to that thing. Um, so what role does, digital marketing play in THMA's success and outreach without giving away all your secrets?
I don't have any secrets with anything. I like to share all my knowledge.
Awesome.
Social media, definitely. Like I said, it was hard for me to accept at the very start. And then, but it's extremely important. You have to have a social media presence. I have, for my social media person, his background is journalism, so
Nice.
which is great, and he knows the medical industry. So because there's certain things that we have to follow through our standards that of advertising rules and regulations that we can't
Hmm.
breach. So, doing a lot of blogs. So he would interview people and do blogs. So we do that. Loved LinkedIn. I think LinkedIn is such an awesome platform, more of a professional platform.
Hmm.
I think everybody has to have Instagram. Like, I think that's just the way that it has to be. But they have to ensure that they are professional, evidence-based is what we say, and pertains to what they're teaching. So like I said, there's benefits to social media. And I think, strengthening your personal brand, and you can be authentic on social media, personal connections with patients. You've got consumer access to information. You have networking that you can network with people across the globe, which is amazing. But then there's the risk where the professionalism is overshadowed by the posts. So
Yeah.
inappropriate posting, inappropriate attire, unethical. I found that nurses were normally very um, nice to each other, very collegial. And then, as with aesthetics, all of a sudden people were putting down other people on social media and being, making disparaging comments and things like that. And it was like, that's not what we do. But it just seems like people were trying to get on top of,
Well, yeah.
and everything should be positive. Our posts should be positive and they should be educational, but definitely digital media is a must to have.
Yeah. Yeah. I know something that I found really interesting. So I've worked with a handful of clients in this space before. And on the Google advertising side, you actually can't advertise for Botox.
No,
right?
true.
So you have um, for it's like Kleenex and tissue, right? I think you can't mention Botox. So you have to get creative in terms of how you advertise and how you get eyeballs onto your posts, onto your website, right?
Yeah.
Have you had a similar experience?
Yeah. It has to do with the Food and Drug Administration because it is a drug.
Yeah.
Neurotoxins or Botox is a regulated drug, so which is why you can't give the name of the without saying all the problems that can happen with it, and you can die.
Yeah.
So um, it's been a you know sort of an ongoing thing where we're trying to teach people what they can and can't do. But you can certainly say, a neuromodulator and what it does. And we tell them add a reference at the bottom to show that it is education,
Mhm.
not an opinion piece, because as nurses, we can't be providing medical advice to people we don't know, who we don't have a therapeutic relationship with. And that tends to be what's happening is that people are, saying, this is what Botox can do and come in and see me, but there's no relationship there yet. Other thing that we tell them, if they really want to, promote, we can't promote specials. We can't say that we have a discounted price. We're not allowed to do that. So we tell them to make sure that they have, like if they're on Facebook, have a private Facebook group just for their patients where they have a relationship with all of these people that are within that Facebook group. And then they say whatever they want privately to people that already know them as a patient. And you can steer people towards that, but you can't just, you know, bring in, say, give medical advice without knowing that patient.
Yeah. And is this national or are there different governing bodies provincially as well? Like, are there different guidelines provincially?
Each nursing college sort of words it differently, but
Hmm.
they're all basically the same. A lot of them have to do with the advertising rules and regulations of Canada,
Yeah.
um, and or through the Food and Drug Act because neuromodulators are a drug. Cosmetics are different, but they all may word it a little bit differently, but they're all basically the same.
Same. Yeah.
And yeah, I think one of the best ones is with CNPS. So that's our Canadian Nursing Protection Society. So they're our liability insurance, and it's a national organization. They have a lot of information to protect a nurse on their website.
Oh,
Yeah,
well, for our listeners, go check it out.
yeah. Oh, absolutely. Yeah, they are
Yeah.
great.
Awesome. Um, you got a lot on your plate. Business, mentoring, speaking, editing, how do you maintain that balance and that personal balance and as well as staying inspired, right?
Yeah. Well, that is a good question. It's, looking back, I guess that I am a little bit of an overachiever. So when anybody would ask me to do something, I would always say yes, because that's how you learn. So, and if it's something that I don't know, I'll say, yeah, I'll do that. And then I have to do all the research to do it. So I always did that. And then eventually things get too much. So I would just sit down and look to see what can I take out of what I'm doing if I'm too stressed out over something. So it'll always be the what's ever given me the most stress. So the last time I made a big change was stopping injecting after 32 or 33 years of injecting because I had the training company I had to manage and I'm the only one that manages it along with my husband. Um, and then I still had a injection practice. So
Hmm.
I decided to hang up my needle, which was difficult to do after that long.
Yeah, no kidding.
Um, but looking back, that was a great choice for me. And then I could focus on the training company, which was good. And the second thing was, living in Toronto, we decided to move to Nova Scotia, which is where I'm from. So
Okay.
that was a good life balance.
Yeah, slowed down a little bit.
Yeah, so I always kind of look at what I'm doing and if there's something that I can change, but I know I love the education part and being a real advocate for nurses and patients with patient safety, that's always going to be key in my books. But I may have to shift around some stuff around it to make sure I have enough time to do it and I'm not killing myself.
Yeah, fair enough.
There is a lot going on.
That's fair. That is very fair. What's a piece of advice that you would give your younger self or a nurse that's starting out?
Yeah, I think aesthetics is a very exciting career. It is not a career that I ever imagined that I would be doing. But it's exciting because one, you can be entrepreneurial. Nurses can be their own, they can be their own boss, though a lot comes with that. But you're blending art with science, and it's really having that ability to do that. It's not for everybody, but once you get it, it's very rewarding for patients because you're changing them on the inside as well as there's a mental psychological component to it as well, but you're changing them physically, which will change the psychological component. I would say before nurses go into this is that they need to have nursing experience first.
Mm.
That makes a huge difference, as opposed to just coming out of nursing school and then going straight into aesthetics, because there is a lot of critical thinking, especially if you're on your own. There's a lot of critical thinking skills that you just don't get from a nursing program that you can get from experience. And it's not going to be a full-time job when you first start. So I think, having a nursing career, working somewhere else, doing this sort of part-time until you build up your practice and you build up your confidence and everything, then you can go into it full-time. But I think you do need to have that nursing experience. Um, I would say they do the background research in the area that they're working. So their geographical area, is it oversaturated? Is there room for growth? What are the other clinics doing? Is there a way that you can make it a little bit more different than what other people have? Looking at the target market, younger clientele, or are you looking at older clientele, or is it women's health, or are you going to concentrate on men's health as well?
Mhm.
And the different services that are being provided. There's so many different services now, not just neuromodulators and fillers. The whole aesthetics is going more regenerative and skin quality and skin health, which brings in
Yeah.
technologies and lasers and things like that, which weren't years ago, they were too expensive. And now they're becoming more affordable and people are more concerned about their skin health.
Yeah.
And formulating a business plan, get your brand, your mission, your goals together before you actually, you look at that before you take a course, and build a network. There is nothing more important than having a network of like-minded individuals that you can respect and rely on, and then watching videos and podcasts and getting as much information as you can. But we do say that, if you're at a meeting, so a new nurse that's at a meeting and you get a KOL that's on the stage and they say, you have to do it this way, use your critical thinking skills. That may not be the right approach. Just because they're up on the stage doesn't mean that that's going to be a good procedure for you. So you start thinking about, critical thinking about what's being presented.
Yep.
So there's a few things to think about as you're
That's
just
all.
going into it.
Yeah. Well, thank you for sharing that. Looking ahead, what excites you most about the future of the medical aesthetics space in Canada?
Yeah, I would say, even though I've been doing this since 1990, it's still evolving. And like I said, regenerative is now, the big component. We used to do sculpture and radius years ago, and mainly on HIV patients. And then it kind of went away. And now it's come back for cosmetic patients because people are concerned about their skin quality.
Hmm.
So I think that's an exciting change, bringing lasers in and microneedling. There's, exosomes and PDRN, I feel they still need more research before you really bring those out too much. There's not a lot of research done on them right now, but that'll be exciting. All the new products, so many new products. Now we have 5 neurotoxins, which is kind of nice instead of having just the one, so you can decide which is going to be the best for you. Um, the technology, the use of ultrasound is amazing. It was, and more studies are being done with ultrasound, because when we first started injecting, and we would inject on cadavers
Yep.
as well, and we dissect to see where it's placed. But we assume that you inject it stays as a little ball when you inject it in, or as a little strand. And we know now with ultrasound, it behaves totally differently than what we think. So that's where everything's changing. We can actually see what happens in live tissue as composed to cadaveric tissue. And
Wow.
AI don't know enough about it. Kind of scares me, but I'm sure that's going to be in our future.
Yeah, no kidding.
Yeah. And I really hope that more training programs do more in-depth, knowledge-based, evidence-based training. And I think that that would make nurses more accountable going forward. So I'm really hoping that, you know, there is some regulation with the training companies as to how they can train and what they can train. So
Cool. Well, that's that. There's a lot. There's a lot to look forward to.
there is.
Um, for our listeners thinking about transitioning into this field, they may have listened to this. What are some of the key takeaways that they should keep in mind?
You know, again, medicine's amazing profession. And there's so many different avenues that you can take for, you know, nurses and physicians, because we train physicians as well. Aesthetic medicine is just one of the small growing, you know, career paths that you can take. And it is that blend of art and science, which is kind of nice that you can be creative. I think it's important for the new providers that want to enter into aesthetics that they do their background work. Like I said, that they're,
Yeah,
you know, checking out the clinics and the services that are offered and how they can be a little bit different. And they'll, you know, be, some people have concierge practices. So you've got, you know, it's more of a, you know, Holt Renfrew kind of thing.
yeah,
But it's exciting, but it's not as glamorous as people think. There's a lot of hard work that goes into it. So I've been on several different, you know, worked with a plastic surgeon, had my own practice, and then worked with a nurse practitioner. So I've been, you know, on all three different aspects of it. Yeah. And each one has its challenges and each one has its benefits. But I think people have to be prepared when they go into aesthetics that there's extra costs that go into it. So they do have to have a little bit of financing behind them. There's ongoing education that they're going to do. I still go to 2 or 3 meetings a year. Insurance, they need an accountant. They definitely need an accountant as they get busier to make sure that, you know, they're doing everything according to, you know, taxes.
yeah,
They need a lawyer to go through all their business information. Social media manager, yeah, if they want to be successful and not have to spend a lot of time on social media, there's some, you know, hire a social media manager to do it. But knowing that the nurses are responsible for what the social media manager puts out, because the nurses know what the regulations are.
exactly. It's being collaborative.
Yes, exactly. Yep.
Cool. And lastly, uh, if people want to find you or learn more about THMA consulting, where do they go? How do they find you?
I mean, we have a website, which is thmaconsulting.com. I am on Instagram, which is thmaconsulting.com. We do have a Facebook page as well, thmaconsulting.com. I'm on LinkedIn. I'm on Blue Sky. So
Okay.
I would love to have more followers on Blue Sky because I'm not on X. And we do have a YouTube channel as
Awesome.
well that shows videos and you know, injection videos and things like that. So I am on there as well under thmaconsulting.com.
Awesome. Well, thank you so much, Tracy. We'll link all those social profiles in the video below so that people can reach out and find out some more information and visit your profiles. I just want to thank you for coming out today. This was awesome. I learned a ton, and I'm hoping our listeners learned a lot as well. Thank you for coming down.
Awesome. I appreciate it. Thank you.
Awesome. Thank you.
Thank you.